So I think, and statistically, Australia-wide, breast cancer rates have gone up about 25% in the last 10 years. So when I started in this field in the year 2000, 1 in 12 women would be diagnosed with breast cancer, and now it's down to 1 in 7. So every day from the time you wake up until you go to bed at night, 58 women will be diagnosed, women and men, mainly women though, will be diagnosed with breast cancer. So that's about 21,000 women a year.
So do you think that, is it because of the numbers increasing because there's awareness?
I think it really relates to ageing populations, and all of the baby boomers are now retiring. That's a huge number of people. I think there's also lifestyle factors maybe in the last 20 years that maybe have had a negative influence and increased people's risk of breast cancer. I think the sedentary lifestyle that we live now, and maybe particularly alcohol consumption in women, and obesity rates, probably all of those things have increased as well.
What they should look into, the signs of having a breast cancer.
So regularly getting to know the look and feel of what is normal for you is the most important thing. Breasts change over time. Obviously they change.
Is there stages of breast cancer, or is it breast cancer and then the treatment?
Definitely there are stages of breast cancer. Stages 1 to 3 are still within what we would call the curable range. Stage 4 is advanced breast cancer, which has metastasized to another part of the body.
With your experience, what do you see? Do a lot of people are in the early detection stage, or they are in the second and third?
Mostly stage 1 and 2. Yeah, but we do see locally advanced.
So is breast cancer curable?
In the early stages, yes it is. Yeah, we have.
Would you think that, will there be a time where breast cancer, we say, is a thing of the past?
The way we treat breast cancer currently will be a thing of the past. In the future, I think that we'll be using.
So there is a myth with cancer and alcohol and cigarettes and stuff like that. I think you mentioned this. It's a choice of lifestyle that leads to all this. But is that really true?
It's now a recognised risk factor for breast cancer, alcohol consumption. And the more that you drink, the higher the risk. And alcohol.
I'll give you a question and you just do a one-liner. So one myth about breast cancer you like to bust?
Men get breast cancer.
Most rewarding part of your job?
Supporting people at their most vulnerable.
Best advice you ever received in nursing?
Don't ever forget what it feels like to be the person in that bed.
One thing people can do today to support breast cancer awareness?
Check your breasts. And check your wife's breasts.
Hey guys, welcome to the another podcast show of Studio 9 FC here. In our today's podcast, we have Megan Lynch, who is a breast cancer nurse with McGrath Foundation. Now, we all heard about this breast cancer, and this is the topic that we're going to discuss in our podcast. Get in deep dive into what needs to be done, precautions, the statistics, and in general, talk about breast cancer. So let me welcome Megan. Welcome to the podcast.
Thank you, Nitin. Thanks for having us.
Not a problem. So, Megan, tell us, how did you get into being a nurse, and especially with McGrath Foundation, and how long you've been doing it?
It was really by accident. I used to be a midwife, so mothers and babies, and then a child health nurse. So I've always dealt with women in nursing, and I stumbled across a scholarship through the Cancer Council in breast cancer in the year 2000 and did that, and then set up a Connect program in Hervey Bay to educate women about breast cancer, and then set up some support groups, and it was sort of a natural process that happened after that.
So what inspired you to work in the field, particularly supporting the breast cancer?
Knowing that I could make a difference for people struggling at a very difficult and vulnerable time in their lives.
So I know it's a thing that as you're a nurse, when you work, you see this every day, day in, day out. So sometimes we tend to get bit numb, but for us, and as an outsider, it's such a big topic, and the awareness is getting out there. Probably 10 years ago, we probably didn't have this much awareness, but a lot more people know about breast cancer. So what can you share with the latest, especially within our region? Have you seen a significant number of breast cancer being increased, or it is reducing?
So we've got higher than average rates of breast cancer in this district. We've got an older population, so our rates of cancer will be higher. We've also had population growth, particularly post-COVID, so there are lots of older people coming into the district. So I used to see on average 100 new patients a year, and last year I saw 180. So I think, and statistically, Australia-wide, breast cancer rates have gone up about 25% in the last 10 years. So when I started in this field in the year 2000, 1 in 12 women would be diagnosed with breast cancer, and now it's down to 1 in 7. So every day, from the time you wake up until you go to bed at night, 58 women will be diagnosed, women and men, mainly women though, will be diagnosed with breast cancer. So that's about 21,000 women a year.
Wow, okay.
So the numbers are huge and they're growing, and because treatments are so successful, there are so many people living with breast cancer now.
So do you think that, is it because of the numbers increasing because there's awareness that people are saying, okay, I'm having breast cancer, I need to go and check, and getting the treatment done and everything?
I think whilst there is awareness, it doesn't always translate into getting breast examinations done and attending for mammograms and ultrasounds. It's fine to know about it, but you've got to do something about it. I think it really relates to ageing populations, and all of the baby boomers are now retiring. That's a huge number of people. I think there's also lifestyle factors maybe in the last 20 years that maybe have had a negative influence and increased people's risk of breast cancer. I think the sedentary lifestyle that we live now, and maybe particularly alcohol consumption in women, and obesity rates, probably all of those things have increased as well. And I think there's probably a bit of a link with that as lifestyle factors that have influenced the cancer rates, as well as it primarily being a disease of being female and ageing. Mostly 75% of women are over 50 at the time they're diagnosed. But we also have 25% of women that are under 50, and it's a different sort of set of circumstances when younger women are diagnosed with breast cancer.
So why is that as you get older, you're more inclined to get a breast cancer?
Breast cancer is primarily a disease of being female, so it's driven by female hormones, estrogen and progesterone. And the longer we're alive, the more cycles our breasts are exposed to hormonal influences, so that increases our risk over time of getting a breast cancer. So it's primarily to do with your age.
So do you think if a younger person can get breast cancer?
Absolutely. 25% of women are under 50, and a significant proportion of those who will get breast cancer that is estrogen driven. But younger women also get, unfortunately, more aggressive breast cancers too. And unfortunately, because they don't tend to do a lot of breast self-examination and attend breast screen, they're often diagnosed later. So their disease is more advanced at the time they're diagnosed. Yeah.
So tell us, to the audience, the people who are watching this podcast, that if someone is in the age of their 30s and 40s, what are the things that they should look into to prevent this? Can this be prevented?
We can't prevent being female, and you can't control ageing. I mean, we're all getting older. So they're the things that are out of our control. They're not modifiable risk factors. The modifiable risk factors are not being sedentary, so regular exercise, eating a healthy diet, avoiding smoking and alcohol, and doing regular breast self-examination. So they're the things that we can do to try and catch it early. And when we catch cancer early, we've got more chance of cure, and there are a lot more treatment options available to people.
So with the early detection, as we discussed, so with the early detection, if someone who is watching this, what your suggestions are, what they should look into, the signs of having a breast cancer?
The first of the month is when I check my breasts. That's when I worm the dogs, and that's when I check my breasts. So I think it's important to have a day on the calendar once a month when you check your breasts. If postmenopausally, it really doesn't matter when you do it, but if you're premenopausal, you'd want to do it after your period when your breasts are less tender and lumpy. So regularly getting to know the look and feel of what is normal for you is the most important thing. Breasts change over time. Obviously, they change when you develop at puberty, they change again during pregnancy, and they change again at menopause. But it's important to know the look and feel of what is normal to you. There is no particular way of examining your breasts, but it is important to know what they look and feel like normally, so that if you find something that doesn't feel normal, you get it checked out. Breast tissue goes up to your clavicle, your collarbone. It goes down underneath your arm, and it covers the whole of your chest wall. So it's important when people do examine themselves that they examine that whole area. Things to look out for are any change in the size or the shape of your breast, developing a nipple discharge, particularly if it's blood-stained, developing pain in the breast or an abnormal swelling, a rash, or discoloration if the breast goes red. Feeling for a lump, finding a lump or a ridge or a thickening. Doesn't necessarily have to be a lump. I've had people diagnosed when they have found a lump under their arm. I've had people diagnosed when they found a lump in their collarbone. I've had people being treated for what they thought was a spider bite, and it was a breast cancer. So there are atypical presentations. Sometimes it's just an itchy rash on your nipple. But if it's not normal for you, if it's something new and it doesn't feel right, and it definitely doesn't look right when you look in the mirror, if you put your arms up and you see puckering, that isn't normal. If it's not normal for you, it's worth getting it investigated. 9 out of 10 lumps aren't breast cancer, but it's better to be safe than sorry. So we would recommend, if you did find something that wasn't normal, that you go and see your GP, and he will do or she will do a breast examination, probably organise a mammogram and ultrasound, and maybe even a biopsy to check out the area of suspicion. So that's what we would recommend that you do. Regular self-examination. If we find breast cancer early, we have much better chance of cure.
Is there stages of breast cancer, or is it breast cancer and then the treatment?
Definitely, there are stages of breast cancer. Stages 1 to 3 are still within what we would call the curable range. Stage 4 is advanced breast cancer, which has metastasised to another part of the body. We can treat stage 4 breast cancer, and we have very good medicines to treat it, but we can't cure it. So once it spreads to another part of the body, it's no longer something that you can cure.
Okay. And is that when they completely remove the breast off?
No. Part of the treatment of breast cancer is to remove the disease locally in the breast so that it doesn't spread somewhere else in your body. Once breast cancer has already spread, there's no point in taking the breast off. So it's important to find it early and remove it so that it can't spread to another part of your body. So we want everyone to be stage 1, very early breast cancer that we can remove and treat.
What is, with your experience, what do you see? Do a lot of people are in the early detection stage, or they are in the second and third?
Mostly stage 1 and 2. Yeah, but we do see locally advanced stage 3 breast cancers. They're larger tumours. They've spread to the lymph nodes, but they haven't spread somewhere else. We see women with metastatic breast cancer. We don't see huge numbers, but we do see women, unfortunately, that have it's already spread by the time it's diagnosed.
So is breast cancer curable?
In the early stages, yes, it is. Yeah, we have over 90% of women will be alive 5 years after a diagnosis, and about 83% of women will be alive at 10 years. So yes, we do get very good outcomes from surgery and treatment for breast cancer, which includes medication, either chemotherapy or hormone therapy, hormone blockers, and radiotherapy.
Would you think that, will there be a time where breast cancer, we say, is a thing of the past?
The way we treat breast cancer currently will be a thing of the past. Okay. In the future, I think that we'll be using different methods to treat breast cancer. Whether we ever eradicate it completely, I'm not sure.
Okay. What is the timeline if, let's say, you're in stage 1 to the cure? What is the timeline you're saying? How long does it take?
Well, we remove the disease with surgery, right? And then we do preventative treatment, either chemotherapy or hormone therapy, and radiotherapy to the breast to try and stop new cancers from growing. We like to monitor these people closely for 5 years from the time they're diagnosed.
So even if it's cured, you mean the treatment is cured and everything, you're still in the monitoring stage where if it's coming back?
Absolutely. We keep a close eye on patients, particularly in those early stages, and we recommend annual mammograms and ultrasounds every year after that to check the breast and the other breast to make sure there's nothing new or there aren't any changes in the breast.
How likely you think that it'll come back? It usually comes back. Does it come back?
Well, like I said, 84% of women are alive at 10 years. But there are some types of breast cancer that have higher risk for spread than others. The breast cancer that most older women get is one that doesn't tend to come back early. If it does come back, it'll often come back later, 10 or 15 years later. Some of the cancers that the younger women get tend to be more aggressive and will often come back earlier. Just depends. There are 4 subtypes of breast cancer. It depends which type of breast cancer you have as to its risk profile and the likelihood of it returning.
I know it's a very emotional journey for many of them when we say breast cancer or someone's going through the family. What do you suggest the emotional and mental challenges with the breast cancer patients?
Yeah, I think they vary depending on people's ages and stages. 80-year-old women that are diagnosed with breast cancer probably are more likely to be accepting of the fact that they've had a life on the planet and they know that their time is finite. So they tend to have a pretty realistic view of their future. A 30-year-old with 2 little babies, 2 little kids, being told that they've got a breast cancer, they'll often have very different needs and concerns than an older person. Will I be alive to see my children grow up? Will I see them reach all their milestones in their life? Who's going to pay the mortgage? What will they do without me? Women are central to family. There are financial burdens for young people when they're having treatment, not being able to work. The impact of treatment on their health and their well-being, the body image changes associated with a mastectomy, the emotional change and the huge adjustment of being told in your 30s that you may have a life-limiting illness. So they have major impacts on people. 50% of people that get breast cancer will have depression. So the statistics are high for people with breast cancer.
What is a message for a younger generation? Is it the lifestyle or is it the age, as you mentioned before? So it's predominantly to do more with the aging.
75% of people are over 50 at the time they get breast cancer, but they have, more often they have a cancer that's driven by female hormones. Yeah. A certain small percentage of people with breast cancer will have a family history or they'll have a gene that predisposes them to breast cancer. It can increase their risk up to 80%. But that's only about 5% of people with breast cancer. Unfortunately, there's a bit of a myth that people think if it's not in my family, I won't get it. But over 90% of women that are diagnosed don't have a family history of breast cancer. So it can happen to anyone, and it really doesn't discriminate.
Wow. Can you share a really happy moment when during your journey where you seen like there was chances of stage 3 and they recouped it and they've been on the other side?
We currently have changed some of the protocols that we use to treat some of the more aggressive types of breast cancer, where we used to do the surgery first and then give the chemotherapy. We're now giving the chemotherapy first and then doing the surgery. And the aim of that is to achieve what we call a complete pathological response. So that means by giving the chemotherapy first, when we go in and do the surgery, there's no evidence of cancer or disease at the time of the operation. And that's pretty much a major breakthrough in breast cancer treatment, because if you get a complete pathological response, there's no evidence of disease, your body has completely destroyed the cancer. So we do see people that have those really good outcomes when they're going through treatment.
So will it, I know that when you do chemos and things like that, it also affects your good cells and everything in the body. Is it very different, the treatment of chemo, than a normal cancer?
All different types of treatments. Breast cancer treatment is quite arduous. It can be long. It can last for 5 or 6 months, the chemotherapy. You will lose your hair. That's one of the problems, the drawbacks with breast cancer treatment, particularly for young women. That can be quite confronting. They can lose their hair and their eyebrows, their eyelashes.
Why is that?
Because it damages the hair follicle, damaging the good cells as well as the DNA and the bad cells. It'd be great if we could just target damage to bad cells. But in the chemotherapy, the systemic treatment for breast cancer, we damage good cells as well as bad. So the skin gets damaged, the nails, the hair, your gut gets affected. People suffer nausea, diarrhea, peripheral neuropathy, nerves can be damaged. So there are lots of potential side effects. And they have to weigh that up, the harm versus the benefit of having the treatment.
So will there be any time what is the other treatment apart from chemo?
Chemotherapy. We also have the hormone therapy for people with hormone-driven breast cancers, where they're on a tablet that blocks female hormones from going into the cell and encouraging the cell to grow. So they're on that treatment for 5 to 10 years. And we also have radiotherapy, which we do for breast conservation. So when people just have the lump removed, they don't have the breast removed, they just have the lump taken out, then we have follow-up radiotherapy to the breast. Yeah.
As a region, Queensland government and the McGrath Foundation is very big when it comes to breast cancer awareness, the treatment and everything. Tell us about a bit of McGrath Foundation. Is it more, I think it's a non-for-profit organization?
Yeah, NGO.
It's an NGO who cares for the breast cancer patients, treatment and everything. How a normal patient who's watching this podcast and going through that journey and they identified can reach out to McGrath?
Well, they could contact McGrath, phone the organisation, or they could contact us at the Cancer Centre in Hervey Bay. They can look us up online. It's Find a McGrath Nurse. And then you can go to the region and they have all of our contact details. It was established 20 years ago this year by Glenn and Jane McGrath when Jane was diagnosed at the age of 31. So she was very young. And she felt that she wasn't really able to get her needs met because breast cancer is primarily a disease of older women. So she reached out to the nurse to ask for support. And that was really what she thought her legacy could be, was to establish a foundation where there were nurses available to anyone Australia-wide, so that everyone had access to information and support while they're going through treatment. So little did they know when they started with 4 nurses that there are now over 300 nurses Australia-wide. So she has left an amazing legacy. I think Glenn's cricket profile was really useful, and he used that really well to promote it. And he has the pink test. That's a huge fundraiser for McGrath and is very successful. So it's been a great success story Australia-wide, and the model of care that we use for the McGrath Foundation is one that is really recognised worldwide.
Is it expensive when you go through this treatment?
Depends if you're a public or private patient. If you're the expense in the public sector is not related to the treatment as such. That is all provided for free. We're very fortunate in this district to have a public chemotherapy unit and access to radiation therapy at no cost if you're a public patient. The cost comes when people have to leave work for treatment. So if you're off work for 6 or 9 or 12 months, there's the potential impact of loss of income, and that's where most of the cost comes for public patients. For private patients, they will be out of pocket if they choose a private breast surgeon, and the outpatient treatment can be costly in the private sector.
So while they're doing this treatment and chemo and everything, you can't work?
No, you're not usually feeling energised enough to be at work, or you don't want to be around people who could expose you to illness while you've got low white cells. So most people, because it's quite an arduous protocol, breast cancer treatment, most people aren't really feeling well enough to work. They can usually work through radiation. They can certainly work while they're on hormone blockers, but most people find it a bit challenging to work while they're having chemotherapy.
And is there any restrictions on what you can eat, or you?
I think you eat what you can tolerate while you're having chemotherapy. Most people suffer taste changes, unfortunately, and nausea, so they don't really have much of an appetite and they don't enjoy eating. So if you find something that you like to eat, we would suggest that you do eat it, or you might need to heavily flavour or salt your food to give some taste to it.
Mm-hmm. So there is a myth with cancer and alcohol and cigarettes and stuff like that. I think you mentioned this. It's a choice of lifestyle that leads to all this. But is that really true, that someone who's been drinking in the younger age or smoking in the younger age are more likely to get cancer than a healthy person?
It's now a recognised risk factor for breast cancer, alcohol consumption. And the more that you drink, the higher the risk. And alcohol's related to other cancers as well. So that is something, it's a lifestyle factor that we have the ability to modify. It's a modifiable risk factor. We can choose not to drink. Smoking's also a risk factor for cancer, because it compromises your immune system. So your immune system gets affected and it can't recognise an abnormal cell and fight it. So that's why we suggest people don't smoke, they don't drink. Use sunscreen, stay out of the sun, and try and keep within a healthy weight range and exercise regularly and eat well, because they're preventative things that we can all do to reduce the chances of getting cancers.
Amazing. I think because this is all so foreign to us. You know, as a normal person, you see these ads, you see these videos, podcasts, and you start thinking how serious it can be. And it is pretty serious.
It's easy to sort of put it out of your mind if it's not directly impacting on you, though. And I think that a lot of people do that. It's sort of, we're not that aware until we need to be aware. Till you know that your mother or your daughter or your sister or your father's got breast cancer, that tends to make people certainly more aware about it. Yeah, for sure.
All right, let's break a myth. Do anyone with not having a family history can get breast cancer?
There's a myth that if it's not in your family, you won't get breast cancer, but 9 out of 10 people don't have a family history. when they get breast cancer. So it's a very small percentage of women have a family history. So that's definitely a myth. And the other myth that I'd like to bust is that men don't get breast cancer, because they do. 1 in 100 will be men, 1% of men. So we usually get about 3 men a year in this district diagnosed with breast cancer. Again, often diagnosed much later, in a more advanced state, because men don't routinely check their breasts.
Okay, yeah. What is one message that you want to give to share to men and women listening to this, that they're putting this breast cancer or checking themselves on the side, like ignoring it? What is one message that you want to give them?
If we find breast cancer early, we've got much more chance of curing it. So if you find something abnormal in your breast, get it checked out so that you can have appropriate treatment to increase your chances of living a long life.
Yeah. Now what we do is, I think we are pretty much on the last leg of our podcast here. So what I will do a quick rapid fire round where it's a one-liner. And so it's basically, I'll give you a question and you just do a one-liner. So one myth about breast cancer you'd like to bust?
Men get breast cancer.
Most rewarding part of your job?
Supporting people at their most vulnerable.
Go-to coffee order on a busy hospital day?
A latte.
Best advice you ever received in nursing?
Don't ever forget what it feels like to be the person in that bed.
One thing people can do today to support breast cancer awareness?
Check your breasts. And check your wife's breasts. I've had some women say that their husbands found the lump.
What color comes to mind when you think hope?
Maybe pink, do you think? Pink for breast cancer. There's the pink ribbon and the pink lady. And McGrath's very much behind the pink.
Favorite self-care ritual after a tough shift?
Taking my golden retriever for a walk.
Very nice.
Wally, down the beach.
Well, I think we are pretty much end of our podcast here, and thank you, Megan, for sharing your valuable input on breast cancer. If you have watched this podcast right to the end, there is a lot of valid information that is in this podcast. If you know someone is thinking or have doubts about breast cancer, do contact McGrath Foundation, because they have an amazing service who are there to help you to prevent or to have a talk about anything about breast cancer.
Absolutely.
Well, thank you, Megan. Thank you very much. Thank you.